Okay, great. Thanks. It is better to start, otherwise we will run late. So good morning, everyone, again. And thank you for joining us on this second day of this European workshop. So online, we have Angelos Cassianos and Timo Clements. They both represent some of the associations participating in the European project Cooperator. Angelos represents the Cyprus University of Technology and the leading association of the consortium of the project. And Timo represents the University of Maastricht, and he's the University of Maastricht is the leading association of one of the work packages of the project, and specifically the one in which we will present also, I mean, you will present your best practices in your countries. So for the sake of clarity, as I mentioned yesterday, the consortium represents 5 different countries, which are the Netherlands, Cyprus, Greece, Italy, and Portugal. And today we will have different presentations from 4 of these countries, because we will have Netherlands, Cyprus, Greece, and Italy. But then, in addition to this, we will have also presentations from Ireland, Malta, Poland, Croatia, and Bulgaria. So I think that they will give us a good food for thought. So I will shut up now and give the floor to Mariano for a brief introduction. Thank you.
Morning, everybody. Dear Angelos and Timo. Angelos and Timo are 2 professors, first of all, and we want to thank for their ability to stay with us today. From your information, here we are with the leader representative of Patient Advocacy Group and Citizens Organization from Austria, Malta, Bulgaria, Cyprus, Lithuania, Poland, the Netherlands, Croatia, Ireland, Italy, and Romania. Connected, I think that should be also from Greece. If I will, if I know, in any case, she should be connected. In any case, from Angelos, my question for you is, for your introduction, why is relevant or should be relevant the output of Cooperator for at European level? What should be the add value of this project? This is my question for you. Thanks in advance for your introduction presentation. And for Timo, my question is, why should be, what is the role of the Patient Advocacy Group Citizens Organization to promote the national observatories for vaccination promotion? That is one of the goals of the project. Today, as said by Bianca, we have invited our partner from different member states to show case history that have in common one characteristic: the direct involvement of citizens and patient advocacy groups in concrete initiative for vaccination promotion. Not only related to the 5 countries directly involved on Cooperator, but more in general related to the civic activism for vaccination promotion. That is our scope, to increase the direct involvement of the so-called intermediate body of the society. So from my side, that This is fine. And Angelos, the floor is yours.
Thank you, Mariano. Thank you, Bianca, for the introductions, and thank you for inviting us also to be here today and for organizing this this event, which I find really interesting. To be honest, as an academic, I'm really tired of presenting research results in conferences. I prefer engaging with people who can actually make a change and who can actually help us implementing the projects that we're conducting. So thank you for the invitation. I'll be sharing my screen. Please let me know if you can see, and I will put my presentation in full screen. Can you see my screen?
Yes, perfectly. Thank you.
Perfect. Thank you. So I would also like to mention that Maria Kyprianidou is also with us today. Maria is the project manager of the project from the side of Cyprus University of Technology. And unfortunately, at some point in around 45 minutes, I will need to go because I'm invited to another event here. But Maria will stay and represent Cyprus University of Technology for the rest of the for today's workshop. So I apologize in advance for that. So yes, thank you for the question, Mariano. I think it's very important that we pose this question because a lot of the time we ask ourselves, what is the point, what is the value of the initiatives that we're implementing or designing or being funded to implement at the European and at the local level? So this is a very important question, and the way that I prepare the presentation is to give not only an indication of the project itself, but why did we end up proposing Cooperator? What is the value of Cooperator? And what do we envision Cooperator to help us with? So this is the consortium. I will come back to it later on. Bianca also mentioned the different countries that participate in the project. But let's start with the concept. So the basic concept of Cooperator and a lot of the work that we are conducting is what we call vaccination hesitancy. And we know that vaccination hesitancy has been for some time now, not only after the COVID-19 pandemic, but before the COVID-19 pandemic as well. It has been one of the top global health threats worldwide. So it kind of makes our work, our public health efforts more difficult. So one way to view vaccination hesitancy is to divide people to those that accept and those who don't accept vaccination. Me and a lot of other people around the world are not in agreement with that differentiation of people. So hesitancy is not a black and white concept. So people who accept or people who do not accept vaccination. So there's a vaccination hesitancy is a continuum, right? So people sit in that continuum. They pose themselves based on their beliefs, their belief system, their attitudes, their behaviors. They pose their person, their individual in that continuum. So more or less hesitant is more accurate. So hesitancy, we kind of define it as any delay in accepting or refusing overall, refusing vaccines despite these vaccines being available for them. And we have seen vaccination hesitancy, for example, to be very common during the COVID-19 pandemic, but we have seen vaccine hesitancy in other kind of vaccines as well. Pediatric vaccines and HPV vaccinations, seasonal vaccinations like influenza, and all of these more or less constitute a public health threat. In Cooperator, we are more focusing on seasonal vaccination, and we focus, for example, in COVID-19 vaccination and influenza, which constitute what we call seasonal vaccination. The value of efforts like Cooperator or other projects around or other initiatives at the European and local level, national level, is to understand vaccination hesitancy, kind of understand what are the mechanisms that drive people towards being hesitant or being accepting towards vaccination or being refusing vaccination overall. What drives this behavior, these attitudes? And also to understand the attitudes and the behaviors of also the stakeholders that are very much influential in promoting vaccinations. And one of these groups is healthcare professionals. So cooperators also focusing on not only on the general population vaccination promotion, but also in improving the skills, the knowledge, and the opportunities of healthcare professionals to promote vaccination. And these factors can be different. It's not one type of factors that can determine hesitancy. It can be socio-demographic factors, it can be behavior factors, it can be attitudes as well. So I'll be very briefly presenting very briefly the research that led to the Cooperator project. So we've been doing research in vaccination hesitancy for some time. We also conducted some research projects during the COVID-19 pandemic, and we wanted to kind of profile hesitancy, so understand a little bit what makes people more hesitant than others. So one study we have conducted, this is a cross-sectional study we have conducted in 6 European countries, Cyprus, France, Germany, Italy, Poland, and Spain. And during COVID-19 pandemic, during the first stages of the pandemic, we found, for example, some socio-demographic characteristics, like, for example, younger people were more hesitant, or those in rural areas, living alone in a place with lower number of residents, or those people not having children were more hesitant. So kind of aligns with some models we use in social and behavioral sciences, like the health belief model, for example, that determines that people's perceived susceptibility or people's perceived severity is very important in their decisions, in their health behavior decisions. And younger people, for example, were feeling less susceptible, or they were believing that COVID-19 was less serious than the older people. But we also found some other characteristics, like, for example, institutional trust. So people that have lower trust in institutions like governments or the European Union or pharmaceutical companies, for example, or WHO, were more hesitant, or those not adhering to other protective behaviors. And of course, those who demonstrated higher pandemic fatigue, those who were more tired with the COVID-19 pandemic. And we followed that with a longitudinal study. So we followed people during the pandemic to better understand their determinants of vaccination hesitancy. And we found, for example, things like their beliefs in conspiracy theories. As these beliefs increased during the pandemic, their probability of accepting vaccination, COVID-19 vaccine, decreased. But what I found very helpful and very interesting was what we call calculation. Calculation is a skill that people have to weigh the pros and cons to vaccinate, right? So as this skill increased during the pandemic, the probability of accepting COVID-19 vaccine increased. And this says a lot, says to us a lot of the role of healthcare professionals, because healthcare professionals have a role not only with the patients that they see, but as drivers of vaccination promotion in their countries to help people making decisions. So to calculate the pros and cons and increase their health literacy. So this is very important. And it also found trust to be a very important determinant of vaccination. So in all of the studies that we did, both with young adults, with older adults, with any type of population, trust was consistently a factor that we found that was very important for people's decisions to vaccinate. So all in all, we found different mechanisms of vaccination hesitancy, like, as I mentioned, trust, socio-demographic characteristics, behaviors, cognitions, and feelings. And we also found some factors that improve hesitancy, vaccination hesitancy, like trust in healthcare professionals, or believe in collective responsibility, or, as I said, calculation, ability to weigh pros and cons, and so on and so forth. And some things that can worsen vaccination hesitancy, like beliefs in conspiracy theories. So here comes cooperators. So this was a project that we thought is valuable because we can bring experts together to develop what we call a citizen-centered virtual observatory. And I will come back to it in a minute, but this is an observatory that can be used by different stakeholder groups. It can be used, for example, by civic organizations, by patient organizations, by policymakers, by healthcare professional groups, by healthcare professional associations, all these different stakeholders that have a role or should have a role in designing and implementing vaccination programs. So we can envision this platform where we can initiate shared knowledge and shared decision-making. And this project funded by EU for Health program, we started in November 2023 until October 2026. And you can see in the graph in the screen that we envision different kind of information or data to feed into the platform and this virtual observatory. For example, we will conduct surveys with healthcare professionals to understand what helps or what hinders their abilities, their skills, and their knowledge to promote vaccination in the day-to-day practice. We'll also conduct some surveys to understand what helps or what hinders the general population decision-making to vaccinate for seasonal vaccination. And we also conduct some other type of studies like reviews or focus groups or policy labs that Timo will present later on, that we try to feed this kind of information and data into the platform. And if you see the right-hand side of the platform, the blue factors is what will come out of the virtual observatory. What do we envision the value to be of this observatory? So one is to initiate shared best practices. So, for example, we have, apart from the policy labs, we also have some policymakers participating in the consortium, like the Ministry of Health of Portugal, who will help us kind of initiate this shared best practices exercise in the platform. So, if you can imagine in the future, both at the EU level and the national level, policymakers or other stakeholders can go into the virtual observatory and the virtual platform, and they can learn from each other. So different countries can learn from other countries what they did well, or what they didn't do well, or what are the recommendations for the future. So this policymaking recommendation is another very important output, if you want, from the virtual observatory. And through the survey data, we can have this mapping of the different barriers and facilitators, both at the population level, but also at the healthcare professional level in different countries. And I will provide an example in a minute. And in the consortium, we have different partners that have helped with in these initiatives. From Cyprus, we have Cyprus University of Technology, which leads the project, and the Center for Social Innovation, which helps which leads the dissemination activities. We have our technical partner from Greece, Computer Solutions. We have our partners at the European level that help us to promote a cooperator and to help with this shared decision-making and policy-making activities, like the European Forum for Primary Care and Active Citizenship Network, of course, which organizes this workshop today. We have our partners from Italy, like University of Pisa and Cesare, from the Netherlands, Maastricht University, the Radboud University Medical Center, and the Ministry of Health from Portugal. And this is we have launched our website quite recently. It's a very simple website that we wanted to be to promote our activities. And you can visit our website. It's cooperatorvax.eu. I'll be sharing my slides afterwards, of course, and you will have access to all the information and, of course, the website as well. So I'm going to skip this because I already explained what the objectives are. But if I can simplify, in a way, the cooperator project, I would say that we're trying to develop a knowledge hub. So we want to promote sharing training and learning resources and experiences between different countries, not only on the countries that participate in the consortium now, like Cyprus, Italy, the Netherlands, and Portugal, and Greece, but also in the future, for sustainability purposes, different countries can join Cooperator. We are very open for different groups to join our efforts now and in the future. We also imagine Cooperator to be a virtual observatory, as I mentioned, so to collect, organize, and disseminate knowledge in a user-friendly way to help different stakeholder groups in their efforts to promote vaccination in their countries and at the European level. And we also imagine and envision Cooperator to be a training system for healthcare professionals to increase their ability to promote vaccination. So we have different work packages, of course, where we develop our platform and where we implement our research activities in work package 4 and work package 5. And mainly what the focus will be today on our policy recommendations that Maastricht University and team are leading and will be presenting afterwards. And before I close my presentation, just to mention what are the models we use, the behavior models that we use to understand and promote vaccination, both at the population level, but also at the healthcare profession level. So for the population level, we use the 7C model, and you can see around the circle of vaccination readiness, the different Cs that are very influential, very important in helping with decision making at the population level to vaccinate. And at the right-hand side, you can see the COM-B model. And the COM-B model, we use it as a model in our initiatives with the healthcare professionals. Because the COM-B model is very well known, it's very much used in policy making, and it poses behavior in the center of stakeholders' capability, like their knowledge and their skills to promote vaccination, the motivation, whether they actually want to promote vaccination, and the opportunities that they have. And this is very important. Opportunity is very important because healthcare professionals might want to promote vaccination. They might have the skills and the knowledge, but they might not have the opportunities in the healthcare system to promote vaccination. So opportunities are also very important as well. And this is an example we use when we kind of try to explain how the virtual observatory might work. You may have, for example, one country having citizens who have high rates of complacency or confidence that can drive the policymakers towards these specific interventions to target confidence, for example, for the population in their country, whilst at the same time they might have healthcare professionals who may struggle with opportunities in the COM-B model that I presented earlier, opportunities to communicate efficiently about vaccines, or time restriction because they don't have time with their patients due to fragmental healthcare systems, for example. And this can also inform policymakers to drive effort towards healthcare professionals in that targeted manner. And all of these efforts in the Cooperator project are centered in the idea of targeted interventions. So we are driven with the idea that one size fits all is not helpful in policymaking. We cannot keep developing initiatives and programs and campaigns that use the same level of interventions for all citizens or for all healthcare professionals. We can use this initiative, Cooperator, to help policymaking recommendations to be targeted to the actual mechanisms that drive vaccination promotion. And before I end, I want to mention that we had our kickoff meeting in January in Cyprus, and we're very much looking forward for the next 3 years of this project. And we also want to thank again Active Citizenship Network and Mariano and Bianca for organizing workshops like this one, or the one that we presented in February ahead of the European elections, where again we presented our efforts to help with policymaking activities at the European level. Thank you very much, and I'm very much looking forward for the rest of the workshop. I'll stop sharing.
Thank you very much, Angelos, for giving us such a comprehensive presentation about the project. So if you agree, I would like to give the floor to Timo, but please, if some of you have questions, keep them for the end of Timo's presentation so that we can do it all together. Thank you. Timo, the floor is yours.
Thank you, Bianca. Let me start the slides. I assume you can see the title slide. Yes.
Yes. Thank you.
Okay. So good morning. Thank you very much for having me. I tried to follow up on Angelos' presentation with some more insights in what we are specifically doing in work package 6 to create a policy recommendation. And I tried to spare you from the technical details, but rather try to focus on, in light of today's workshop, how we envision a co-creation of solutions here and recommendations, and as well in how we want citizen advocacies and patient advocacies group, but as well a broader set of stakeholders to be involved in that co-creation process. And I'm taking, Mariano, your question towards the end of my presentation and try to come back to it. So in terms of translating the research evidence that is already out, but that we are as well going to collect in the Cooperator project towards policy recommendations, there is the concept of a policy lab, where we try to bring together diverse people that have an interest and insight to the policy process, and try to translate the research evidence into knowledge and let's say intelligence that is relevant in order to create policy. And the idea for the policy lab is that we early on would like to engage with stakeholders to identify certain barriers or knowledge gaps that we potentially could still incorporate in the work that we are doing. And then towards the end, when there is the idea of the toolkit, Angelos' examples of how could country A profit from experience in other countries, how would this need to be designed, presented in order for the diverse groups to take this on. So this is an early engagement, and towards the end of the project, there is different focus, and obviously there is a continuous back and forth of information. So it's the policy lab is meant as an interface between expert and policy insight, so that on the one hand, our recommendation are, yes, evidence-based, because let's say the recommendations should be right and based on the right information and target the right behaviors or interventions towards behaviors, but they need to be worked out so that actually people can take them on and can work with them. So they should address certain target population and obviously need profiles. Looking at COM-B factors, domains in COM-B and the 7C group, obviously. Now, in terms of our planning for the policy lab, we are looking at a policy lab composition of around 20 stakeholders coming from, yes, healthcare professionals that are involved in vaccine promotion, doctors, nurses, but obviously as well pharmacists in a number of countries, and it may not be limited to that. And I would be happy to hear if there's someone else we should talk. We see a role for industry here as well, and we would like to engage with decision makers in the countries that are involved in the project, but as well at in Brussels as well. And yes, as we would, as a fourth broader group, like to engage with you, with civil society organizations and patient organizations in order to see their views towards the policies and the recommendations to be developed. In terms of the agenda, I said one important early engagement that we foresee is to understand the obstacle and challenge for implementation and as well transfer early on, and then to discuss towards the lifetime of the project our upcoming results and co-design them towards recommendation and the digital observatory and how people could interact with the outputs of the observatory. So this is towards the policy lab composition and agenda. And finally, once there are potential outputs that we have proposed, we would like to take another step in order to see in how far our recommendations are in fact acceptable, feasible, and usable. And here there is currently the idea to bring citizens, professionals, policymakers within countries together in a focus group type of a forum in order to make our evidence-based recommendations, again, having another route with not just with academics, but with other groups that are really towards implementation to see, is this really something that seems to be possible in practice to apply and implement. And finally, I take our slides on the observatory that Angelos already presented in terms of the, I would call, output towards the left-hand side and the outputs in blue towards the right, in order to try to answer your question, Mariano. So what is the role of citizens and patient advocacy groups in the national observatories? And let's say, remaining rather close to the agenda of the project. I would say it's on the one hand important to be involved early on in order to guide us towards what are knowledge gaps that we may not have covered by our research methods, and as well what are potential barriers and obstacles that we have not identified from our desk review in order to take that on. So there, and that may be even more important or equally important than towards the end to see how is that what we are proposing actually possibly working out, and how can you blend that with your actual practice. So this is, for me, one dimension. There's a kind of timing dimension, but to me it's as well the dimension of a what and how. So on the one hand, I definitely see a role in what information is important, what should we collect, what currently is not collected, and what kind of actions should be sparked from this information and these insights. But equally important, the how. How should we present that information in the observatory? And how should actions, I mean, we may understand clearly what is effective, but it may need a different design and a different approach in each of the countries. So I see as well a clear role in engaging and co-creating towards the how. How should this be designed, and how should this be presented in order not just for academics to be understood, but as well for those who should finally work with this information towards creating impact. And I think this is my answer. I'm looking forward to engaging with you and hear your views on this. Thank you very much.
Thank you very much, Timo. So does someone have questions? No? Yes, sure.
Timo, thanks very much. I'm just thinking there, how do you define industry as part of your stakeholder group? What do you see as industry?
We define industry as those industry that is producing vaccines currently. But I think I can share that we have currently a discussion in the consortium in how to integrate them in the policy lab or not, because some of us see them as part of the solution and some of us as part of the problem. So we currently within the consortium have a lively discussion on how to involve them in the policy lab.
Okay, because the reason I was asking for it was in Ireland now, when there's some of these really big projects, you will include in industry the likes of TikTok, Google, Facebook, Meta, to have some representative from those particular computer, how would I say, it's agencies, so that they're a part of and understand. It's an education process as well, that in developing and looking at what you're producing, they're also getting an understanding of what the real issues are and worries that people have because they're at the table. So I would just make that as a suggestion. And obviously, you know, I take it that there's a whole ethical background to the way the project was set up. So therefore, you know, when you're looking at the how would I say, the legacy industry, which would be the pharmaceutical, that there are processes there to protect the independence of the various people. But I think it's very important nowadays to include the Metas and the Googles and the TikToks in these sort of deliberations.
Thank you. Yeah. I don't
Sorry,
know if yeah.
No, I'm just saying, I've just been asked to say, my name is Stephen McMahon. I'm from the Irish Patients Association. Sorry, my apologies. Yeah.
Thank you.
Someone else? Oh, yeah, sorry.
No. Thank you. I think we for now we have rather our discussions on industry representatives has centered around the pharmaceutical industry. I see. I mean, I think I would take that to our Athens meeting in 2 weeks to discuss. Let's say in my other work, again, I'm trying our students to make aware of using social media as well for health promotion, but at the same time, obviously, other industry know how to use social media as well to advocate for their products and sometimes for their harming products as well. So there is a kind of background noise that you work against, but that doesn't mean that you shouldn't engage it for health promotion activities.
Thanks. Yes, Mariano.
Angelos and Timo, yesterday we had the pleasure to host WHO and someone from the team dealing with the behavioral insight. We spoke about the behavioral insight, the behavioral science, the nudging approach in the context of vaccination, because we think that it's important to be aware about this aspect, starting from our role, citizens organization, patient focus groups that have probably the role to motivate, to identify which kind of behavior we need to put in place to try to increase vaccination coverage, etc. So my question is, within the consortium, do we think to involve also WHO in some part of the activity as they are developing some aspect on behavioral science, and they have also promoted some pilot initiative on it? Yesterday they presented to us an initiative extra European Union, but also within the European Union they are active on it. So this is just a suggestion. Thanks.
Thank you, Mariano. I would say that we are in contact with the behavioral. I think it's the unit, the Cultural Insights unit. For work package 4, where we develop our surveys, because the WHO Europe, actually, where this unit belongs to, has developed a very interesting tool set of surveys and interview materials, focus group materials based on models like COMB, for example. That is one of the models that we use in our proposal. And we got in contact with them, and they are very happy to be involved in that aspect. But listening to you, Mariano, I think there's value also to involve them in other parts of the project as well, like the dissemination or the policymaking activities. So I would be very happy to follow up on that with you and see whether you have initiated a discussion or a connection with WHO or WHO Europe, and we can invite them. We can, for example, invite them with them in one of our meetings, the meetings that we conduct, maybe not in Athens because that's too soon, but the next one, which will be in Pisa in January, might be an opportunity to invite them or co-organize together with you and other members of the consortium a workshop together with WHO Europe and the Behaviors Insights unit we can present our results to them, or we can involve them in the whole idea of the cooperator platform. So thank you for the suggestion. I would say that we are in touch with them, but only on a small part of the project. Listening to you, I can imagine other initiatives we can involve WHO as well.
Thank you.
Thank you. Someone else? No. Okay. I think that probably both of you were very comprehensive, and I thank you again for being here today remotely, but here with us. And so I think that we can move to the next session, which is the advocacy one. And during this, we will listen to different experiences in the different countries. And I would like to start with the Netherlands. So yes, your presentation is the first one. So I will give you the remote control.
My apologies before we start. Can I ask, is this recorded in some way, or will we have the opportunity afterwards to listen to this? Because as I mentioned, I need to go, but that would be very...
Angelos, feel free to leave. Thanks again. We'll publish all this presentation in our web site. So there is the opportunity to share this presentation also after this meeting.
Thank you very much. Thank you.
All right. Thank you very much. Before I start, I just want to emphasize that I'm not only speaking for the Netherlands, but I'm here today also in kind of a double function as a representative of EPEX, but also in my job for EUPrevent. And both organizations are active in the border region between the Netherlands, Germany, and Belgium, which is the Euroregion EMR, the Euroregion Meuse-Rhine. Just still a few words, what is EUPrevent and what is EPEX? EUPrevent is a foundation that is active in the Euroregion Meuse-Rhine and connects various partners in the area of health promotion. So we have a total of 40 partners and also 170 informal partners in our network. And they are all from public health related organizations. So for example, public health services, but also universities. The Maastricht University is also one of our partners. And we have thereby created a very broad network support system. And we really want to serve our network partners, and we work on mutual projects and knowledge exchange across borders. And we, for example, assist also with project funding, project execution, and we are organizing also network activities and knowledge exchange activities across borders. And EUPrevent works closely together with EPEX. EPEX is a foundation as well, active in the same border region and making sure that in cross-border projects, the voices of citizens and patients are always involved, especially when we are talking about projects that have an influence or that seek ultimate influence in policy making or policy decisions. It's of course essential to make the citizens' voices heard, and EPEX does that by, for example, organizing citizen summits, interviews, and also serving as a citizen advocate and voice. Because EPEX and EUPrevent are both network organizations, we, in preparation for today's presentation, we also got in touch with our network partners. And I want to divide it a little bit up by country, what we heard from Germany, Belgium, and the Netherlands. And I will make a start with Germany. Basically, all our findings or all our discussions that we had previously with our partners were also reflected in the discussions that we had yesterday and today already. And but starting with Germany, we had the impression, or we got the information that there were actually not a lot of big campaigns with regard to adult vaccinations in the past years. There was not so much focus on adults, but more on children, actually. And what we saw in Germany, that only when there was a perceived need of vaccination. So for example, in one region, we had a big measles outbreak. Then the efforts for measles vaccinations were also successful. And that led to the recommendation that we as citizens and civic organizations, but also public organizations, should also always make sure or make clear that the vaccination efforts or vaccinations are not a goal in itself, but that's of course always connected to an actual disease or an actual threat that we want to work on, and not to focus too much on the vaccination efforts itself, but always connected with the disease we want to address. And also something that we heard, that when vaccinations are being promoted by official bodies, like for example health services, that this can lead to adverse effects, or that it can intimidate, especially people who have who are immigrants or who are refugees, that they are always a little bit hesitant when there is like official communication involved, that they fear that there might be repressions as soon as they might decide against vaccination. Or that people with a migration background are a little bit more hesitant when it comes to like official communication overall. And there we got the best practice from one of our partners, that they connected with like community peers, but also with interpreters in order to reach out to these people. And that proved to be very successful in Germany. And I'm moving on to Belgium. We had a very extensive meeting with our Flemish partner, with the University of Antwerp. And basically, the University of Antwerp also confirmed what we heard yesterday during the WHO presentations. So that general practitioners and healthcare professionals are one of the most important and trusted sources when it comes to information around vaccination, and therefore, of course, when advocating for vaccinations, that it's always important to closely work together with the healthcare professionals. And also what was interesting, that older people tend to have a little bit more confidence in vaccinations than younger people. And therefore the suggestion was in campaigns about vaccination, or also when we want to work on getting in touch with citizens and convince them about the benefits and convince people about the benefits of vaccinations, that the focus should also lie a little bit more on younger people. And then a little bit more, the general suggestions were that the societal and individual benefits of vaccinations should always be highlighted, that of course communication efforts should always ensure or assure people about the safety of vaccinations without being intransparent also about the risks. And what we also talked yesterday about is that often people tend to have a feeling that they are being coerced into receiving a vaccination, and that vaccination efforts and PR efforts, we should avoid to use too aggressive tactics and to not push people to get their vaccination. Then what we learned from the Netherlands, in the Netherlands, communication efforts around vaccinations are usually organized on a national basis by the National Institute for Public Health and the Environment. And there is a big focus on online PR campaigns. And one good example was, for example, the HPV PR campaign that ran over the last 2 years in the Netherlands, and that targeted younger adults, which were 27 or younger. And the PR campaign was delivered in Dutch and English, which is also, I think, a very crucial point to try to make it as inclusive as possible, to deliver it in several languages. And also what we see, I think, very nicely on the pictures, to also use inclusive, inclusive images. And also to address the the target group with like visuals that resonate with them. I think here we also see it that, I think the visuals are designed in a way that, it really resonates also with younger people. Because we are both cross-border organizations, just a few words on the cross-border perspective. We already mentioned it yesterday, what should be ensured also when we have when we want to communicate about vaccinations is that when people live in border regions, and for European citizens, it's about 1/3 of the people who actually live in border regions, that people tend to fall through the net. And we should be aware of that when we actually execute the vaccinations, but also when we want to communicate about vaccinations, that we always make sure that when you live in one country and work in the other, that you don't fall the net in terms of communication efforts, but also that you can receive your vaccinations in the country. And some conclusive messages from our partners that I still want to reflect here is that willingness is not the same as coverage when it comes to vaccinations. So when people get their vaccinations, that doesn't always mean that they were also actually convinced of the effectiveness, and we should always aim, when we want to communicate about vaccinations, that we actually boost vaccination confidence and not only convince the people that they should get the jab now, and And then, of course, the enhancement of health literacy. That's something what we talked about yesterday. Health literacy combined also with media literacy, that we shouldn't only focus on isolated vaccination campaigns or communication, but try to work on improving the overall health literacy of the population. If there are any more questions, we will share the contact details. You can always contact Hui and me.
Thank you very much, Marlene. So I would like to move to the next presentation, which will be made by Andreas Christodoulou from the Cyprus Federation of Patients Associations. Thank you.
Yeah. Yes. Sorry for the title. The title. Fine. We are ready? Yes, we are. So, good morning from me again. It's just a short presentation of what we are doing in Cyprus from the hands of patient organization and not from the government as much. So this is the immunization scheduler in Cyprus. This is the official version, and the last version was given to ECDC in April 2024. So I have put the link on below so you can see also your countries, what are the official versions of their scheduler in your countries that they are provided by the Ministry of Health in ECDC. As you can see, we are having, most of the vaccinations. Let me see the pointer. Perfect. It doesn't show. So, mostly our vaccination, as most of the countries, they are done in at a young age. So most of them are below the age of 11. And this is the recommendation of doses for all these conditions that they are mostly common. I'm not gonna get into much technical details because you're gonna see, I have the slides as well. So, but I just put a slide for children. I know that they were talking about other vaccination, but it's important to talk about prevention. So especially for young ages, by the age of 30 months, you can see that in Cyprus, we're providing children under the general health system free for all these conditions. And after that, up to 11, we do some vaccinations that are repeated for tetanus, pertussis, diphtheria, and etc. So I'm just going to talk about mostly about HPV in this slide. we have all heard discussing about HPV, and I don't know how many of you know what is the HPV virus, what this can proceed. That's why I put this slide here. So the human papillomavirus, it has more than 100 varieties, and it's shown that it can cause warts and of course different type of cancer. So for that, one of our members, it's a cancer organization, League, started from 2010, as I mentioned yesterday, a campaign about HPV. And by 2016, we managed to put it in schools environment. And after our general health system, because it's a new one, it was established in 2020, our general health system. So now it is fully endorsed under the general health system. And it's also done in the school environment for let me just, slide, you see, from boys from 9 to 14, and they also cut at the school environment, and also in their pediatricians, they can do that vaccination. Before 2020, when it was implemented in the general health system, vaccination were given to our member organization. So some of them, they were provided free to children and through our member organizations, but now it's universal access. So this is something that I would like to point out, that if you start a campaign, as a patient organization, you can put your Ministry of Health under a lot of pressure and to make it universal access to everyone. And of course, I will just give you also some links of their campaign that they make with nice videos and leaflets with included children. And also now moving on to the influenza vaccinations and COVID-19. Of course, the Ministry of Health provides seasonal influenza and COVID-19 vaccinations free of charge, especially for preventing and public health interactions. And we have established a list of priority groups that they are providing for free vaccination from both influenza and both COVID. They are slightly different between influenza and COVID-19. And just to mention here that the vaccination of the beneficiaries of the general health system can be done also by the personal physician, the GP, under an appointment, but also for people that they are not under the general health system, like immigrants or minorities. They can also be provided free in the regional vaccination centers that the Ministry of Health has all over Cyprus. I have put here the population groups for the influenza. So you can see it's anyone over 60, children and up to 15 with these conditions, pregnant women, regardless. So this is a point that who mentioned yesterday, that they have pregnant as number one in their criteria list for vaccination. So yeah, we all have the pregnant women regardless. And we also have this one was done like 2-3 years ago with recent scientific proof that we have seen that children and adults long-term aspirin therapy, they have more potential risk for Reyes syndrome after influenza. So we have implemented that also in our population group. All right. Perfect. And I have put also the population group for COVID-19. As you can see, there are, of course, more categories into that. Again, over 60, you will see here healthcare professionals of any age. And all of these are under pregnant women as well. And these also are free, provided under for COVID-19. We have established a platform for national vaccination where you can book your appointment and make your COVID-19 vaccinations. And lastly, I will talk for some initiative that we have done as a patient organization. We have created via our Facebook page, we have done some digital campaigns for vaccination and addressing general public questions. So we were posting a lot of busting myths, fast checks about vaccinations. And the other thing that we did, this was in general for vaccinations, but specifically for COVID-19 related, we have created a Facebook group, and it was in Greek and English. And we had a multi-scientific committee behind. We have doctors, healthcare professionals, the president of the National COVID-19 Committee. So each citizen could go into that Facebook page and write a question about vaccinations or even for anything related to COVID. And that group of people, they were addressing those risks, those fears, and it was published to everyone. So we saw through that, we got like 100 messages every week. And so we publish a lot of them. So we make them aware to the rest of the public as well. And we also had a dedicated phone center. It was a 24 hours phone center during COVID for psychological aspect, where professionals will address the common fears regarding vaccinations. We had around 3 psychologists working around 3 days with the help of our member organization that they had. They were given psychologists that they're working with them. So that's me, and I have put my contact details for anyone that you like. All right, thank you.
Thank you very much, Andreas. And actually, thank you also to Marlene, because you both had the perfect timing. So I would like to know if someone has questions for them. Otherwise, I would suggest you have questions.
Yeah.
Yes, Maria.
No, just to know if in Germany, Madeleine, if you have find the attention, the involvement of the association, because when we realize initiative across Europe, to be honest, we don't find too much interest to the association from Germany, etc. So what is their level of engagement in your initiative, if any? And for Andreas, HPV campaign, it was an institutional campaign, if I well understood. Yes. And it was also some direct involvement of the association.
Exactly.
Okay, so Marlene, yeah.
Yeah. Actually, indeed, it can be quite complicated in Germany because, healthcare is also organized slightly different in all the federal states. So therefore, it can be difficult indeed to find access to the right organizations. But in our case, we are, for example, in touch with other civic organizations like the Caritas, or which then actually have quite a lot of outreach again to citizens within our region. And we also are in close touch with self-help groups. The self-help system in Germany is pretty well established, and through these kinds of contacts, we are actually reaching out to the German broader population in Germany. Yeah.
So yes, I mean, it was an initiative of one of our cancer patient organizations that it was dealing at that time with increased cases with HPV. So it was something that they saw abroad. So they went to a European event. So they saw that there was a recent cases of HPVs, and they saw that the vaccination, back in 2010, it was just the beginning of them. So they had some scientific proof that it helps when you vaccinate it. It was at the beginning, 13 to 15 years old girls only. And in the recent years, after 6 years with our help, and we went out and with some more scientists, we saw that the scientific proof said that from children 9 to 15 and girls and boys, it decreased a lot of the cause of HPV virus if you have the vaccination. And we lobby a lot with policymakers, and we managed to have it in the government.
Thank you very much. So the next presentation will be made by Ioanna Liatsou, who represents the Hellenic Liver Patient Association, and she is connected online. Hi, Ioanna.
Hello, how are you?
Good morning. Thank you for joining us. Thanks. Do you prefer that we share your presentation, or do you prefer to do it yourself?
I will share it.
Okay, great. Thank you.
Can you see the presentation?
Yes, perfectly. Thanks.
Great. Good morning, everyone. My name is Ioanna Liatsou. I am a sociologist, and I currently work as a project manager at the Hellenic Liver Patient Association, Prometheus. Today, I'm standing in for the head of the board of Prometheus, Mr. George Kalamitsis, who unfortunately could not join us due to some health issues affecting a family member. At Prometheus, our mission is clear and resolute. We strive to provide access to healthcare and advocate for the rights of every liver patient. However, our commitment goes beyond that. We focus on those who are often overlooked or face significant barriers to healthcare, including people who inject drugs, people in prisons, people living in a state of homelessness, migrants, refugees, and asylum seekers, and sex workers. These communities face unique challenges that hinder their access to essential healthcare services. Through our advocacy and support, we aim to break down these barriers and ensure that every individual, regardless their circumstances, receives the care they deserve. Our mission is to act as a crucial bridge between marginalized populations and the healthcare system. We strive to achieve this mission by providing comprehensive information and education about liver health and treatment options, advocating for policies and prioritize healthcare access for all vulnerable populations, and collaborating closely with healthcare providers, governmental agencies, and NGOs to create supportive environments. By bridging these gaps, we not only improve health outcomes, but also promote dignity and equity in healthcare for everyone. Viral hepatitis multi-country community screening, vaccination, and care project, or else VH-COMSAVAC, focuses on reducing the incidence of liver cancer through comprehensive strategies centered around education, prevention, and harm reduction. By the end of April 2025, VH-COMSAVAC aims to achieve, we want to perform rapid test examinations to at least 600 individuals to each country, Greece, Italy, and Spain. Increased awareness and knowledge about hepatitis prevention among target populations through educational workshops, reduced incidence of hepatitis B and C infections, and increase the number of people vaccinated against hepatitis B, improved health outcomes and quality of life for individuals living with viral hepatitis, enhance collaboration and knowledge sharing among healthcare providers and community organizations across Greece, Spain, and Italy. One of the core components of VHCOM-SAVAC is the implementation of examinations through innovative street work activities and partnerships with local NGOs. We specifically target vulnerable populations, including refugees and migrants, in diverse settings such as Korydallos prison, which is the largest prison in Greece, which houses a significant number of these individuals. By conducting screenings and examinations in these environments, we ensure that essential healthcare services reach those who need them most where they are. We also recognize the importance of collaboration with local organizations that already support refugees and migrants. By working closely with these organizations, we can better understand and address the healthcare challenges faced by refugees and migrants, ensuring that our interventions are effective and culturally sensitive. Our communication strategy is multi-phased. We are developing target materials designed specifically for refugees and migrants. These materials aim to dispel common myths about the transmission of hepatitis B and C. Additionally, we are producing informative videos translated into multiple languages spoken by migrant and refugee communities. These efforts are crucial for ensuring that health information is accessible and understandable to all, regardless of language and cultural background. To encourage participation and facilitate project implementation, especially in environments with diverse needs, we are utilizing incentives such as supermarket vouchers and prepaid phone cards for prison settings, for example. These incentives play a vital role in fostering engagement and ensuring that beneficiaries actively participate in screenings and educational activities. One of the significant challenges we are addressing is the lack of active social security number among refugees and migrants. This number is essential for accessing free vaccination against hepatitis B and treatment services in general in Greece. To overcome this barrier, we are advocating for temporary insurance numbers through partnerships with local organizations for undocumented refugees and migrants who live in the general population. We focus for our efforts on prison settings because through our interventions in recent years in Greek prisons, we have achieved a legislative change. Now, all prisoners in Greek prisons, even those who are not entitled with a social security number, are issued a temporary health care number for people in prisons. The process is issuing this number to every uninsured prisoner has already begun. For this reason, we conducted and held meetings with the directors of various prisons around Greece to inform them about the project and to map the population of refugees and migrants in each prison. As of May 31, 2024, a total of 497 individuals have been screened. A key outcome of our efforts is improving access to a health care system for vulnerable population. To date, 48% of those screened reported having access to a healthcare system, indicating progress in connecting individuals with essential medical services. Out of those screened using rapid test technology, 32 individuals representing 6% tested positive for hepatitis C antibodies. Additionally, 12 individuals accounting for 2% of those screened tested positive for the hepatitis B surface antigen. Notably, there are 3 individuals who tested positive for both anti-HCV and HBsAg. 6 individuals have been fully vaccinated against hepatitis B as part of our vaccination efforts. Vaccination is a crucial component of our strategy to prevent the spread of hepatitis and reduce the incidence of liver cancer among vulnerable populations. This low number primarily stems from the challenges in follow-up communication, including the lack of stable contact information and difficulty in reconnecting with individuals who were interested in being vaccinated. Additionally, the fact that we are dealing with a mobile population makes communication even more challenging. For example, we had some cases where the first dose of the vaccine was done, but we lost communication with the beneficiaries. We hope that our presence in prison settings would be an opportunity to increase the number of people who are fully vaccinated. Thank you for your time. You have any questions, I'm at your disposal.
Thank you very much, Joanna. Yes, Mariano has a question.
No, I'm very curious. Thank you and congratulations, Joanna. I'm curious about the economic incentives that you used, if I well understood, prepaid phone cards for car and the supermarket voucher. What about how much in terms of the prepaid €5?
The voucher, supermarket voucher is €6. And the prepaid phone cards, we have a telecard is €4, but we give two phone cards because the time is not enough for the telecard of €4 to call to their homeland because many of them want to communicate with their family. So we give 2 telecards of €4.
Okay, and it works, this kind of economic incentives for the target group?
Yes, it works for the screening progress, for the vaccination process. It seems that if they already want to be vaccinated, they will proceed to the vaccination.
Thank you.
Someone else has questions? No. Okay. So, Joanna, thank you again. And we will now make a very short break. And also we would like to take a group photo before someone of you leave. Thank you. Sorry?
Exactly. Also for the checkout, you have time.
Yes,
for the checkout.
exactly. Thank you. So does someone needs to make the checkout or something? No? Okay, so let's say that we will have a 10 minutes break, okay? Thank you. And thank you online. So I think that we can start again. And so the next presentation will be made by Stephen McMahon from the Irish Patients Association. Thank you.
Thank you. Good morning, everybody. I'm just sort of, what I've done here is just put a few charts from a presentation I'm giving tomorrow in Dublin, which is dealing with the whole area of AI, with all of these AI scientists and all the rest of the industry that are actually doing that. And I'm trying to remind them that you know, that really what we're talking about are, you know, deliverability with patients' rights, and also in the context of immunizations, which you mentioned yesterday. And I think at the outset, I'd like to say thanks very much for your hospitality. The in-person dinner was a very good moment to actually get back and share stories with people and get the feedback as to how, even though we had a lot of fun, we still covered some really important issues. And I'd like to mention just two very quick things that surfaced in conversation last night. One is that we tend sometimes to look at people that won't participate in vaccinations as anti-vaxxers, or, you know, that they lack capacity with the knowledge and so on. And really what surfaced was that it's actually in our charter, while we talk about innovation and safety and quality, we also have probably the right to consent. That people can say, I'm not giving my consent with the knowledge they have about the what's on offer to them. So I think it's a little bit, you know, we need to be a little bit humbler that, you know, that it's not all about somebody that hasn't got the knowledge or is anti-vax or whatever, but that there is an issue here of consent. But I would say the important thing is that it's informed consent, that they have the information to make those decisions. And the other thing that surfaced last night was a very pragmatic comment that somebody reminded me of, which is that even with all how perfect we think we have everything lined up and all the rest of it, it depends. Isn't that right, Andreas? It depends. So it's just, again, in the various aspects of our work, even in daily, when we're, you know, presented with them, you know, wonderful projects and great ideas and the solution to all problems, that it really depends on maybe a lot of other factors. And that's sort of just again, just a quick aside from a very entertaining dinner last night. So yes, you know, we are co-founders of the European Patients Charter. This actually was the presentation of it in 2005, all those years ago, at Dublin City, or the Royal College of Surgeons, where we presented that to Irish society, and it's remained on our mast for the last 20 odd years, and proudly so. And I think that what we're saying here, again, as I said yesterday, that the language of advocacy is patients' rights and its stronger potential of 10x. And you're saying, what in heaven's name is 10x, and what is stay left, shift left in 10x? It actually goes back to a UN General Assembly in 2022, the scientific subset of that, where the Manhattan Declaration was given about staying left, shifting left, and getting 10x. And what that means is that what we're trying to do is the continuum of care in our lifetime, from birth until death, that you're trying to keep everybody, and this is not because we drive in the left-hand side of the road, but like that we're keeping everything to the left of actually being treated in hospitals. And because that's where all the really high cost is. So in all of these areas, and you probably could add to that, what you're trying to do is to ensure that the patient is actually treated as close to where they live, and, you know, and to keep them out of the acute hospital care system. And the point I want to make about this is the 10x is that with the use of electronic patient records and so on, that you will actually get a multiplier of 10x productivity out of actually going this route than the traditional models of developing your acute services. They are important and there's crossovers there, but that's really the direction of we're doing that. And immunizations lifetime are critical in actually helping achieve this. by keeping people out of the acute hospital systems and also preventing impact on their lives and so on. So I just thought I'd throw those two charts in there to put it into place. Again, you've seen from Cyprus there, you know, these are the age groups for the flu immunization that's free, and it covers more or less the similar numbers or similar categories as we saw earlier. I will say, as I said to Mariana, that I will get the presentation on HPV, the Laura Brennan. It's in honor of Laura Brennan that it's officially, that's the public health system. And we did have back in 2014-15, 87% of women that were in that category for screening. That was the performance, and then it dropped off rapidly, and now it has begun to rise again. But 97% of women that have been identified as having a problem will be treated, are treated currently within the 12 months, and it's actually a lot sooner than that. So our organization has been very active in the area of, how would I say, advocating for children to get the free flu vaccine. It's a nasal spray, not an injection, which makes it nice for the kids. But what we wanted to do before this was to do research as to what were the attitudes of the general population to that. And so the researchers' empathy there did you know, that is the breakout of the gender and of the age and of the different regions in Ireland and the socioeconomic classes, so that you would have a representative sample to say, this is at that point in time what people thought. So I'm not going to overburden here because there's nothing as dazzling as numbers, but basically you can see there that the instance of hesitation to get the children the free winter vaccine, that there was only in Dublin there, which is the fourth row in, if you can see it there, 31% had a hesitation versus up to 53%, 49% in the Munster area, which is a particular, it's in the southern part of the country. And really the point I want to make about this is that it's like what we heard yesterday. We're lining up similar sort of exercises that you can, like Ireland is a population of about 5 million, 32,000 square miles. You know, yes, it's education and so on, but you do have these regional variations in the attitudes to getting vaccinations. The reasons for hesitation to get the children the flu vaccine was concern over adverse reactions, 62%. Perception that the flu does not have serious consequences, 26% felt that. And you weren't aware of the children's vaccine at all, 18%, which was important considering the amount of push that's done publicly with the health system and organizations such as ourselves out there to actually, you know, encourage people to do it. So this was an interesting one for particularly like, and I'm sure there are many other member states where, you know, it's normal for both parents to be out working and still bringing up children, and with all of the responsibilities that entails in getting to kindergarten and school and so on and so forth. But we wanted to find out, like, where people were, you know, what was the you know, the percentage of parents there that claimed that children had missed school days due to the flu. And 51% of them said that their children had missed school, and that has a big knock-on effect to their, you know, having to organize their households and all the rest of it, as well as look after kids that can get very seriously ill as a result of that. Again, 6 in 10 parents claim that the biggest impact of their child missing school is missing the learning opportunities, with 36% claiming they had to take time off to look after their children while they were sick. And again, that can give you sort of, it's not often thought of, you know, the other aspects of having someone sick. It doesn't matter whether it's a child or an elderly relative or friend, that this has that sort of impact. And again, these are sort of the kind of things that one keeps in mind when you're trying to do your messaging. Again, you know, this was just really to say, did you know that it was a nasal spray? They 72% said yes, and then others had different aspects of it. Awareness that the flu is not the common cold, you know, because that's a common thing. People think, oh, it's just the cold, you know, when in actual fact, it's a nasty infection. So over half the parents could be aware that flu is not the common cold, and it can have serious consequences, such as ear and respiratory infections. And the Dublin region, 43% are more likely to claim that they're aware of that. That's one of the main reasons why they actually get their children vaccinated. Yeah, that one there about the instance of knowing that children are major spreaders. Over 3/4, 77% of parents are aware that children are major spreaders of flu, and when infected, they can be contagious for longer. Again, it's just another aspect to be aware of the impact of that. So they were I've more or less voiced the various key findings there. So what we did was then that fed into our campaign of Flu United. That's our minister on the left-hand side last year. We get a lot of support from the system. That's my granddaughter there with me pointing my hand out to the sky. And you know, we reached out to diversity, inclusion, and the importance. Like last year, we used this famous Irish football player, and the lady on the bottom right there is a major social media influencer who's a pharmacist by profession and has quite a significant following in that. So I'm not going to do all the flattering clips from the papers and from the TV and radio and so on, but merely to make the point that, you know, that we had a very wide target in what we were trying to hit, and to make the points about the children, being sick and the impacts and dangers and so on, and that this was available free. And they expanded that. I think towards the end of the campaign last year, the Department of Education has now opened it up to the schools, which again has a big impact. Somebody discussed it yesterday, that it's easier if your child is going to get the immunization in school rather than you having to take time off and go and visit a pharmacist or whatever. So what are the quick lessons? Looking back on it, it's very important to build partners within civil society and within the public health system. This year, we will be linking in a little bit closer with our public health system. We have been invited by one of the very large pharmacy chains to, where we still going to go ahead with another campaign this year. They were interested in supporting that. Don't forget, pharmacies are really important because they get huge footfall. They get more footfall through a pharmacy than you would in probably your local Tesco's or Lidl or whatever else it is. Do the research, it's worth it, and understand what the resistance, and is it a communications issue or is it opposition? And, again, being mindful of what popped up last night's discussion about consent, that, the people, to respect them. And I think somebody mentioned this morning about not laying down the law that you have to do this because the world is going to fail, but that you're actually providing them in a respectful way, in a dignified way, what their options are. And the target audiences, like we've heard again this morning about people from different ethnic backgrounds, socioeconomic groups and so on. And while socioeconomic groups, we may be able to compare one with another around Europe or whatever, but again, you have to take into account the bigger picture of what is the education level, what time did they actually drop out of school and so on. And they're all part of your campaign. And again, I think it was Andreas mentioned about information to patients and to the public, should I say. In Ireland, we have over 17 different languages covered, from simple Mandarin Chinese to, some of the African languages and so on. And not only do they have it in printed format, but they actually have a video from somebody with those backgrounds to be able to convey that information. So while I might often have criticisms of our system, there are, as I say, some very good things developing in that space. And again, I just want to make the point that these exercises are expensive. For your own information, it costs, we had to go out and raise something in the region of about €70,000 to run this campaign, to get the research, to get the experts and all the rest of it. And for our accounts this year, as we've no financial resources, we all do it pro bono. We have to make a point in our accounts that this was not towards salaries and operations. This was going to PR companies and other media to pay for it. And so that's why I think it's important that events like this give us an opportunity to share, the experiences, because that's where you can save yourself a lot of money, because you're not reinventing the wheel, and that to leverage our experiences off another, that it's an ongoing experience. And again, just to touch on something that surfaced again last night, I think, was that when we tend to look at immigrants and refugees and all of that to say that that there's resources being diverted from the population that's living there to these groups to facilitate supports and so on, that that is really an investment. Like last Saturday, I was a guest, the speaker at the Irish Sickle Cell Institute, and sickle cell, as we learned, has mainly affects people of African origin, the Middle East, and so on. And almost everybody that was there were maybe new citizens or maybe first generation. And what struck me was that they had done research into their disease, and they turned up that there was 5 million pieces of research on cancer. If you go to PubMed and you do all your searches, 5 million, and yet there's only 60,000 on sickle cell. So that tells you where the attention is. And again, the amazing thing was that these are all fantastic doctors, young people in their 20s, doctors, nurses, research, computer engineers, so when we hear about this thing about it might cost us a penny today, but you get a far bigger payback, a 10x back, in less than a generation. And I'm just making that point because we can get lost with these sort of interpretations. It's just a different view. So with that, I'd say thanks very much. If there's any questions, feel free to ask away. If I didn't go over 10 minutes.
Congratulations, Steven. Congratulations. And don't have a question about the content, but as it was so rich, the data that you have collected, and this is an example of how relevant is the data collection also from a citizen patient perspective. My question is, did you already publish, not only, of course, I imagine in your context in Ireland, this research, but also outside at European level in some peer review publication, because I think that should be the case to try not to widespread your activity, this research, and we can probably also facilitate if you wish, etc.
Happy to share it all, and I think we did send it to the Commission, and we've obviously sent it to our own health authorities. But here's something really interesting. When we went public, on our big launch, the news editors in our TV, our national TV, were not anxious to take it because it came out that the sample size was, say, 750. But that was the sample size that the experts say will tell you about your population, plus or minus 2 or 3%. And it was because that they, the funding actually came from AstraZeneca. But the thing is that the perception was that because this wasn't a 1,200 sample size, that this was a lesser value document. When in actual fact, all the professionalism of the research company were delivering on a representative sample. But then in the same network, on their the news programs that discuss various things, we had somebody there to explain it all publicly. So you can have this sort of, you have to be firm with the media. Sometimes you think, well, oh goodness me, they're, but you're right to stand your feet or stand your ground and say, no, you're wrong here, and this is the situation. So just another little insight.
Thank you very much. Does anyone have questions? No. Okay. So the next presentation will be made by Christine Balucci from Malta Health Network. Thank you.
Thank you. Okay, so I'm going to give some short background about the vaccination, national vaccination system in Malta, as a background to what NGOs can do. No. Okay. Okay, so our vaccinations are primarily administered and organized through the primary child and youth health immunization unit. It's got 3 units within it: the well baby clinics, the school health services, and the national immunization service, which tie up the immunization schedule very, very nicely between them. No.
It's the other way around.
Okay, okay.
It's the other way around.
Oh, sorry. So the National Immunization Service is responsible for the administration of all vaccines at all ages, and its office is at a main health center. And like I said, it coordinates all vaccinations given from all health centers, community and hospitals. And it also offers travel advice for people needing vaccinations for travel. But all 9 health clinics will give out vaccines, and all vaccines for children under the age of 16 are free in Malta, and obviously EU citizens. The school health services is a team of doctors and nurses who provide monitoring for children in state and church schools for free for the end of use. So at 3 years old, there's a mandatory assessment and a reassessment at 5 years old. So this, when we see this, will coordinate. So at this level, they will be checking whether they have taken, whether they're up to date with their vaccinations schedule. And at the year 10, at year ages 14 to 16, the diphtheria, tetanus, polio, and meningococcus is administered in schools. This we found that the rates dropped. We had very high rates for the first 3 doses, but the rates for the booster dose was very low. So we decided to do them in schools. Medical practitioners, private GPs can also vaccinate children. It's the choice of the parent. Obviously, against the cost, they will have to buy the vaccine and they will have to pay for the doctor. This is the schedule. I'm not going to go through it for children. And all these vaccinations are mandated by law. And there's an advisory committee on immunization, which gives. I'm going to skip these for a moment to speak about the flu vaccine and the COVID-19 vaccine. Again, they are both free. We give flu vaccine and presently also COVID. I don't know this year what will happen, but our priority age group is 55 years over, or if under 55 years, with those chronic diseases which other member states have. It is, they're widely advertised in our news, TV, or our news newspapers. It's quite a, sort of, we look forward for our influenza vaccines. Okay, so the role of NGOs. It is quite a comprehensive system in Malta. Malta is a very small country. We have very low rate of people, of children not attending school. So we were quite well covered. So we don't have much experience, except for when we had the COVID-19 emergency. The Malta Health Network with our sister association, the SOS Malta, we're coordinating, made a call for volunteers to help out the authorities in several aspects, including immunizations, but also like contact tracing and the helplines. And we were supported by other NGOs. This particular NGO, for example, is the St. John's. It is a rescue and first aid provider, NGO, and they were actually giving vaccines, and it was a very big help during COVID. Other than that, we sort of, the Malta Association for Public Health Medicine is the association which I represent on MHN. We use social media to communicate, you know, especially influenza vaccine. The government also, the authorities don't do a lot of campaigns, except when a new vaccine is out, like the HPV. But otherwise, it is more on a one-to-one basis during the school visits and things like that. Okay, so thank you. That was very less than 10 minutes.
You were perfect. Thank you. There's any question? No. Okay, so thank you again, Christine. And then so we can move to the next presentation, which will be made by Marta Culpa from the Institute for Patients' Rights and Health Education in Poland. Thank you.
Thank you. I represent the Institute for Patient Rights and Health Education in Poland, and I would like to show you two projects addressing to vaccination promotion, which are really important for us right now. The first is Alliance for Combating Infectious Respiratory Diseases, Poland Breathes Healthily, and the second, Forum for HPV Elimination. So the first, Alliance. We started this project in 2021 as an answer for lack of a plan for a long time strategy for adult vaccination in Poland and lack of an official vaccination calendar. Adult immunization, it is still not prioritized in health policy in Poland, and we are the lowest, one of the lowest vaccination rates among the adults for respiratory diseases, infectious diseases. We invited to this project for the biggest patients organizations in Poland, working in a field of oncology, diabetes, cardiology, and pulmonology. So this is basically high-risk group population. And we tried what we want to achieve: establishment of vaccination recommendations for vaccination issue in Poland, and development and also implementation of official vaccination calendar for adults. And in 2022, Active Citizenship Network became our international partner. And what we try to achieve, we want to gain together one big voice to be better heard. So we invited to this initiative also many experts, and we try to deliver arguments for decision makers and main stakeholders. We prepared together two reports, Diagnostic and Therapeutic Pathway for Patients with COVID-19, which was first such a report in Poland. And the second, Infectious Disease, the Respiratory System, Challenges and Recommendation for the Future. And we also prepared Carpathian Declaration for Health, which is a document calling for strategic action. And as you can see, it was 2022. And in this year, in February 2024, many of these recommendations and requests was implemented, was including two recommendations for the Minister of Health regarding access to lifelong vaccination for patients in Poland. And right now, this document is proceeding in the Ministry of Health. Those are experts of this initiative. That's not only patients, organization leaders, not only healthcare professionals. There's also economists, sociologists, as you can see, our international partner, Mariana Wota, you can recognize. And last but not least, Bartłomiej Chmielowicz, Mr. Bartłomiej Chmielowicz is Polish Patients' Rights Ombudsman. He supports us in this initiative. And the second project, which is absolutely brand new because we started it 2 months ago, It is Forum for HPV Elimination. Poland organized national HPV vaccination program 1 year ago, so we've got 1 year experience of that, and the results are not satisfactory. Almost 20% of teenagers are vaccinated right now. What we want to achieve, the goals: increase awareness of HPV risk and available prevention among stakeholders and society. But also we would want to support the implementation and increase accessibility to the nation HPV vaccination in program. So we invite to this initiative four organizations in Poland, basically working in the field of oncology and health education. We've got 2 ambassadors, Dr. Monika Wankiewicz, she's pediatrician, and Tomasz Sobierajski, he's socio-medical researcher. And together we prepared report Pulse and HPV vaccination. And because I've got only 10 minutes, so I say that the most important result for us, it was the huge lack of awareness of HPV infected related risk of cancer. There was a European vaccination week. There was a lot of debates, meetings in the same, which is Polish Parliament, in a parliamentary, in the National Institute of Public Health. But I'd like to tell about the fourth one, briefing, which was a press conference. What do Poles know about HPV? We showed to the journalists the results of our report. And another report that we prepared last year. We ask people in Poland what disease they are afraid of the most, and they put cancer in the first place. The second was stroke, the third Alzheimer's disease, but the first it was cancer. So we are afraid of cancer. We've got a vaccine that can use vaccination can protect against HPV related cancers, but we don't use it. Why? Because in Poland, people don't link HPV with cancers. So it's like 3 letters, but they don't connect it. So we tried and we ask journalists to change their communication, to start talking about HPV and HPV-related cancers. So it's not vaccination against HPV, but also HPV-related cancers. And what happened next? Those are chosen articles, those titles, and it happened. They take it very seriously, and they started to talk about cancers and related and HPV and HPV-related cancers. And this is our small but first success. We see it as a success. And we also, with our partners, prepared recommendation of patient organization to increase the effectiveness of this HPV vaccination program in Poland. We showed it to the representatives of Ministry of Health during this special organized meeting 2 weeks ago. So this is, as you can see, this is 7 recommendations and requests, which in our opinion are the most important right now. And this document is proceeding in Ministry of Health. I didn't translate it, but the most important right now is accessibility, and to change this program because it's not friendly for anyone, for users and for medical practitioners who need to use it to order, for example, the vaccine. Every complaint about that. So as I said, this is only 2 months. This is brand new initiative, and this is still open initiative. If you want to join us, if you want to support us or share with us with your experience, please do not hesitate in contacting us. Thank you for your attention.
Oh, thank you. Thank you very much, Marta. So I
have some
yes.
reflection. Your presentation remember me to something related to the policy brief document discussed yesterday, because we assume to collect your suggestions in the next 2 weeks, etc. But if you want to add also some references, document published by your organization, etc., you can do it. There is also an indirect way to provide evidence and visibility to the document published. So take in mind also this option. At least Renata, but no.
Yes.
There is
The
also
next
another
one.
one.
So we
Also-
will
also-
have
okay.
yes, Bulgaria and then
Also
Croatia
Italy, eh?
and then Italy.
Okay, so there is
So
one time.
I give the floor to Renata Ilieva from the Bulgarian Association for Patients' Defense. Thank you.
Thank you. I tried to answer to the policy brief document in national plan, like to understand more about our policy and about vaccination. So I didn't answer to all of the points, but at least I tried. Okay, so about the promoting immunization culture throughout life. In Bulgaria, the lifelong immunization is not a priority of the Ministry of Health because there is a national program, what we spoke about yesterday, for improving the vaccination prevention of seasonal influenza and pneumococcal infections in persons aged 65 and over 2023-2026. So the free flu vaccine for people over 65 in 2023 actually covered 30,000 people who were 300,000, so who were vaccinated through GPs, representing about 70% of the group. There are more applicants than the Ministry of Health has purchased vaccines. That's why yesterday I spoke about that purchasement of the vaccination, that it has to be on time. The goal is to reach 35% coverage in 2026, which in our association, we believe it will be not reached as the number of vaccinated people increases annually by about 2.5%. And the free pneumococcal vaccine with the goal is reaching 15% coverage by 2026, with priority given to the chronically ill with lung and cardiovascular disease. Next place about the recognition and strengthening the participation of civil society in adult vaccination. Our chairman, Mr. Taushanov, is a member of the National Council of our National Healthcare Insurance Fund, which is a monopole. We have put before the representatives of the state in the supervisory board, deputy ministers of health, that the number of both types of vaccines should be increased, that there should be no budget restrictions from the Ministry of Finance and the Ministry of Health, which would be transferred to the National Healthcare Insurance Fund to carry out the vaccines from the GPs. But unfortunately, the GPs do not carry the necessary information campaign for the likeness of the age of 65 plus to these vaccinations. And we anticipate this year to create such an information campaign through directors of medical centers and medical facilities. On next place, about the data and evidence for decision-making in support of scaling up national and immunization programs. We're about to have a meeting with the Ministry of Health about the vaccinating mothers during pregnancy against the respiratory syncytial virus. I have to note that we still doesn't have this type of vaccine because it's a leading cause of acute respiratory tract infections. The various strategies to prevent the RSV infection can be divided into two categories: the passive immunization with monoclonal antibodies of infants of vaccination of the mother during pregnancy, and the active immunization of adults. The maternal immunization during pregnancy is a promising option for protecting infants during their period of greatest vulnerability to RSV infection and severe disease. The aim of vaccination during pregnancy is to raise the levels of maternal antibodies against various respiratory pathogens, including the RSV, which protect newborns through transfer across the placenta, so-called transcendental transfer, and to maintain these levels of protection for 3 to 6 months of life. The passive immunization is also expected to continue during the lactation period, thereby preventing both first and subsequent infections. With the advent of new vaccines, there are possibilities for effective prevention of RSV infections in patients in risk, especially those over 60 years of age, who should be offered protection against respiratory infections with the available RSV vaccines before the autumn-winter season, in addition to those against influenza, COVID-19, and pneumococci. The RSV vaccines can be given concurrently with the seasonal flu vaccine, and I wanted to know in your countries, what is your best practice? Do you give it in 2-in-1 or on different times? I'm interested about this. And what we propose for Bulgaria is which the population over 60 years of age is 1,009,100 people, and an expected evidence of 10.5% of them. You see how much people will reflect, and that's why we want 10% of the vaccinated in 2025, 12% in 2026, 15% in 2027, 17% in 2028, and etc. So it's not possible to reach the 35%, which is recommended by the European Commission. The citizens' access to vaccines. Regarding to the faster access of the population to vaccines, the Ministry of Health should promptly make requests to the pharmaceutical companies for delivery no later than 6 months before their implementation. And what we expect to happen and insist on, but which has not yet been accepted, the vaccination to be carried out of the PMS for children and schools in the pharmacies, and for adults at their workplaces, also in the pharmacies, what is written in the policy brief document. Digitalization is still not a required level of the part of the Ministry of Health, which was created by, there is a new project which is called Plus. It's from the Ministry of Health. But you cannot find the vaccination centers in it, and nor there is any information about the vaccination campaigns in the regions. So, for example, the information campaign of the Ministry of Health on COVID-19 was delayed by 6 months, and it was launched 3 months after the end of the acute COVID wave, for which the chairman of our organization warned the Minister of Health 8 months earlier. And on the last place, about the support of the European Commission recommendation. In relation to the viral infections that cause cancer, the recommendation is aimed in particular at promoting adherence to 2K vaccination capable of preventing viral infections that can cause cancer. It's the HPV and hepatitis B. So the recommendation is part of the European Health Union's plan about beating cancer, but it's estimated that around 40% of cancer cases in the EU are preventable. In the 2021, in the member states allocated only around 5% of total healthcare spending for prevention. In January, we had a meeting with Ms. Stella Kyriakidis about this, and we actually mentioned that all those levels of percentage which should be covered, they're not at least at 15%, and it's written that it has to reach 40% to next to 2027, which is not possible, and to 90% in 2027, which is also not possible. So the proposal we're making is bearing in mind the experience of accreditation of the GP's practices in Ministry of Health to include all general medicine specialists of these practices, as well as through the regional health inspections and educational inspectorates from the Ministry of Education to carry out vaccination of the schools themselves. And additionally, we may communicate details for our intentions. In addition to that, in 2021, I made one research about the vaccination as a social administrative obligation in my university, because I'm in my last year of studying law. So what we understood there are a lot of barriers contributing to the population about not doing the vaccination. I'm not telling about the COVID-19, I'm telling about all the vaccinations. On first place, the factors were for the safety of vaccines. On second was about the lack of information. On third one was about the low risk of the disease. And on fourth place was the disbelief in health institutions. And those are actually the doubts of the population. On other place, I think it's what you said about the informed consent. They were giving informed consent about the COVID-19, but in our Health Act is written that every injection or invasive medicine should be also provided with informed consent, and this is not given for the other vaccinations. It was given only for COVID-19, which we think is also a huge mistake in our Ministry of Health. And that's it, if you have any questions.
Thank you. Thank you very much. So the next presentation will be made by Jasna Karadzic-Zanetti from the Croatian Association for the Promotion of Patients' Rights. Thank you. Thank you very much. First of all, thank you, Mariano, Daniela, Bianca, for these events. Very important for discussion every year and 2 times a year, 3 times a year. And I'm happy always to be there. So I want to share this article, what is published I do some research about, actually that was for one pediatric congress, because pediatricians report me that they have very big issues with the parents who there is I mentioned yesterday, vaccine hesitancy and some ethical concerns about right to refuse vaccines and right to freedom, right to choice. And I try to answer to them with this article and present it on the big pediatric congress in Croatia. And so I will just go in the summary of the article, because it's a long. So escalating childhood vaccination debate raises profound ethical and legal concerns for pediatricians, but as well for all of us, as vaccines hesitancy proves to be a complex phenomenon shaped by social, cultural, psychological, and economical factors. Despite attempts to encourage vaccination adherence with campaigns like this, also appeals from pediatrician societies often fall short, with hesitancy theories focusing on factors like misinformation and distrust in general and the public. In order to combat hesitancy, has the public education and awareness campaigns and proposed aiming to address concerns with evidence-based information, what is very important. However, when all of these communications first, penalties are considered, what we saw in several EU countries, with limited research on their impact, because we don't know the outcome of penalties, what one parent can pay, and is the problem result for the government. For example, if you are a parent and you refuse vaccination of your child, and then you pay about 300 euros, and then for the government in several countries, in majority of the EU countries, it's considered like problem resolved. So, but it's not resolved. The children remain unvaccinated. And so there are unclear guidelines on non-compliance. The legal landscape is not the same in European countries, from relatively modest fines imposed in Croatia to the stricter measures enforced in Poland and France. The European Court of Human Rights acknowledges the delicate balance between these individual rights, what we can also see here on the panel from European Charter of the Patient Rights, and public health, underscoring the societal importance of vaccination. Pediatricians grapple with these ethical dilemmas, especially in situations where fines proves to be ineffective. Denying access to public community groups or institutions to a child becomes a last resort, done for the purpose of prioritizing community well-being over individual choices. So if you don't want to vaccinate your child, there is no possibility to go to public school or even events or something like that, what is made in the groups. Strategies for the pediatrician protection include informed consent, clear communication, and meticulous documentation, though conflicts may arise in situations where non-vaccinated children face exclusion from nursery schools, because there were very appeals to court about this that was not possible to access to children to school and to education if not vaccinated. So in conclusion, a NASA approach is crucial to address the complexities and the legal ramification of vaccine hesitancy. The clash between health rights and freedom of choice necessitates legal reforms behind preventive measures and other punishment measures, emphasizing the importance of education. Education is always what I want to highlight. And the future research also should explore the impact of these penalties, vaccination rates, and the post-penalty status of vaccinated, because the problem is not resolved once when the parent pay some fee, about 300 euros, 500 euros, and the problem is still here. And thus contributing to a more comprehensive understanding of this multifaceted issue. So we still have a problem. And for the end, I want to show you one campaign. It's not related to the vaccination, but it's related for this European Charter of Patient Rights. What can be good example also for any of you to do locally. This is unfortunately it's I don't know how to play link and just go. Is it possible to play link and just go too fast to the link? Just that you know what we did. We actually asked all famous singers in Croatia to record one video, one of these rights. So we have 14 famous person in the Croatia, and they self-recorded video with my introduction. Why is this important? And on the local language, and that we made, and so it was like a campaign in a local, and now we have a focus to do it also in European level on English language. But it is one good example, so you can do it. Okay, can you link? No, I don't know if you can. It's not link. Okay, I don't know how to. Yeah. So practically, it's not important that are famous person. It's a good if you can do it, but the video campaigns like this can really help. I don't know if link can be. Can you maybe put my computer or no? Okay. Then I will send you the link by email, and or it's easily on YouTube, so you can share it. That's it for me.
Thank you very much, Jasna. Actually, as already mentioned, we will share all these materials in the coming weeks. And so we will publish them not only on our website, but we will disseminate them through our channels. So all of you then can easily access all of this. So just a moment. Yes, sure.
I have two quick questions. First one to Renata about you were looking for some information. You were asking for some information. If you could just let us know what it is. And then also on Jasna, I was just wondering, the penalties are there for parents who aren't getting their children vaccinated. Are there penalties for healthcare workers that don't get vaccinated, or is it just parents of children?
Okay, so my question, and it's coming from our chairman. I'll read it. We had a conversation with the chairman of the Bulgarian Pharmaceutical Union. They want to carry out this vaccination for flu and pneumonia for 65 ages plus, but there is no decision from the Ministry of Health yet. And in connection with this, we're interested in the experience of the other countries, how this has been implemented through pharmacies, as well as what is the experience in vaccinations for MMR in schools, since we need to make a qualitative leap due to the lack of interest of the GPs and lack of quality information campaign for the population to vaccinate their children.
Any other questions also from the people joining us online? Okay, I think it is a no. So, okay, this will be our last presentation. So I won't go into details of the first slides just because all of you by now know our association, but I prefer to include them as we said, because we will publish them in the coming weeks. Okay, today, so I'm happy to share with you a project that we carried out in 2022, and which is a concrete example of how citizens can play an active role to support vaccination public policy. The purpose of our activities was the drafting of the quality charter of the vaccination services, identifying the civic principles that must characterize a more effective and efficient organization of services to citizens. The initiative was based on two pillars of Cittadinanzattiva-Active's work, which are the civic evaluation, and so the monitoring phase of the public service, and then the Charter of Patients' Rights, which is a grassroots initiative based on civic participation process and advocacy. So civic evaluation can be defined, civic evaluation can be defined as the ability of organized citizens to produce and use information to promote their own policies and to participate in public policymaking in the definition, implementation, and evaluation phase. Civic evaluation can be defined as a citizen-led action research through the use of established methods. And according to this method, when citizens, despite their supposed lack of experience in the public sphere, organize themselves and act together on public policy, they are able to produce and use information from experts and other sources, as well as from their direct experience with the issue addressed. The aim is not only to take a picture of the situation or report problems, but also to assess the quality of the public service from the specific point of view of end users, which are the citizens and patients. So we use different tools for the data collection, which were questionnaires to vaccination centers and local health authorities. Also the direct observation of facilities and services together with health workers, and the direct surveys of patients' pathways and experiences. So the second instrument is the Charter of Rights, which is a document containing a set of rights or quality standards that express ways to protect the more general right to health. And these rights, although recognized by laws or guidelines, are often unknown or violated.
And so what makes a Charter of Rights different? So as we said earlier, it is a grassroots initiative based on a process of civic participation and advocacy. It is not legal or technical, but arises from citizens' reports and complaints about violations or inefficiencies. And also it allows rights to be through specific actions. To be concretely enforced through specific actions. Okay, so the monitoring phase involved 8 regional health departments, vaccination centers, 147 from 13 different regions, but also 212 general practitioners, 270 pediatricians, and covered different targets as children, adolescents, adults, and the elderly for all known COVID vaccinations. Oh, no, sorry. Okay. As you can imagine, the pandemic has had a major impact on the organization of vaccination activities, especially in the vaccination centers where routine procedures have been considerably penalized. And so we found out that more than 40% of the centers surveyed have suffered reduction in staff and opening hours, and 1 center in 10 has even been closed. And then by the end of 2021, all closed centers had been reopened, with opening hours restored in 79% of cases, while staff had been reinstated in only 47% of the centers. According to our survey conducted in Italy by interviewing 2,990 chronic patients, 29.7% of them reported difficulties in accessing routine adult vaccinations during the first wave of the pandemic, and 90% of them also at the end of 2021. The 33.9% of them reported also difficulties in accessing vaccination for children during the first wave of the pandemic, and 16% of them also at the end of 2021. Other data suggest an urgent need to achieve greater uniformity in vaccinations, as the differences highlighted create inequities and risk reducing trust in health institutions. For example, speaking of routine vaccinations, in Italy, from an organizational point of view, there is often a lack of regional agreements with the categories of GPs and pediatricians on the possibility of carrying out vaccination in their own clinic or setting. And where the regional agreements do exist, not only vaccinations are administered by them, but not all vaccination are administered by them. And with regard to recommended vaccinations for the same target group, free vaccination is guaranteed if carried out in the recommended age range. But if it goes beyond that range, in some cases, it is paid for, and in others not. Also, in some health districts, up to 3 months elapse between the booking and the actual administration of compulsory non-vaccination and recommended vaccinations. And when monitoring routine vaccination coverage, only for influenza vaccination, the data is collected regularly. Also, vaccination is also guaranteed in the afternoon
in less than 80% of vaccination centers and 85% of GPs and 75% of pediatricians surveyed. But on Saturdays, vaccination is only guaranteed in 200% of vaccination center, as Mariano mentioned yesterday. But last but not least, there is a great demand for modernization and investment in these vaccination centers. Also, bookings still rely almost entirely for the 82% on the telephone, and to a much lesser extent on other usual channels like emails or call letters, while it is rarely possible to book online in 2024. Well, a few years ago when we ran the survey, but yet it's shocking. In more than a third of cases, there is no provision for electronic payment, and this also give food for thought. So the second phase of the work consisted in drawing up a quality charter for vaccination services, which identifies the quality principles to which facilities should aspire in order to offer citizens a service that it is not only of a good standard, but above all homogeneous throughout the country. The charter consists of 6 fundamental principles, which from a civic point of view represent the founding aspects of a quality service that guarantees: first, the uniform access throughout the territory; second, the transparency and consistency of information; third, the adequate training for operators and safety for users; fourth, the simplification of procedures through a high use of digital innovation; fifth is the provision of effective strategies for achieving vaccination coverage; and last but not least, the promotion of a continuous improvement and quality assessment approach. And each principle is spelled out in a series of recommendations addressed to the various institutional levels and, where necessary, to the citizens themselves. The recommendations contained in the charter addressed to the various stakeholders and national and regional and local level, as well as to the citizens themselves, include the production and dissemination of information and awareness raising campaigns that motivate citizens to make informed choices based on validated scientific knowledge, also to fight the issue of fake news; and an easy and rapid access to all vaccination information, and the promotion of homogeneous and consistent training throughout the country; the implementation of the law that provides for the establishment of the national vaccination center and regulates the regional ones; the implementation or adaptation enhancement of the electronic health record; the publication also for recommended vaccination of an annual coverage data, as is already the case for the flu vaccine. And when defining new diagnostic pathways or updating the existing ones, the inclusion of recommended vaccinations for specific disease targets. And so also the collaboration of local health authorities, vaccination centers, GP, pediatricians, and pharmacists to guarantee active calls for the identified targets, sending citizens information or on their vaccination status, managing booster shots, monitoring unvaccinated people, and missed appointments. So As a matter of fact, the Charter, it is a concrete instrument of action that must be promoted among institutions, public and private actors in the health system, professional and their associations, citizens and their associations. It should be used with the aim of recognizing and improving the local context, and also should be officially signed and adopted. It can be used as an evaluation and participation tool to assess whether rights and standards are respected. And it can be also used as a common basis for evaluating health services in Europe from the perspective of citizens. The ambition is that this charter can be adopted and implemented by all the stakeholders that carry out the governance of vaccination pathways, also making use of the support and active contribution of all the stakeholders involved. And the implementation of the charter represents, from our point of view, a process of growth with a twofold positive implication. On the one hand, it fosters a process of self-assessment of the organization of services, and on the other hand, it indicates a model to strive for. And that's it. Thank you. Any questions? No. Okay, so we are almost perfectly on time. Thank you very much for joining us, both in person and remotely. I give the floor to Mariano just for a quick
Thanks. Yeah. I want to thank you, each one of you, for your time, for your decision to join us, to stay far from your family, your context, but to stay here committed to promote vaccination policy, to support the public policy on vaccination at the national level, but also at the European level. Thanks also, Timo, for your time. It was a pleasure. Just for your information, Timo, this was a close meeting by invitation. So we have invited leaders from different countries, from different patient advocacy group and citizens organization. We will realize another 2 days meeting, much probably in hybrid format in October 14 and 15, in which we will discuss about vaccine preventable respiratory disease. Day 1 focus on COVID, day 2 focus on flu and other respiratory disease. And we also discuss how to interact with the new elected member of European Parliament and European institutions, starting from an analysis of the composition of the European Parliament. And to do so, we are in the process to produce some document that allow to open the dialogue with the European institutions. So in the next few days, we will receive, as already said yesterday, invitation to collect your insight for the policy brief, the document for the for vaccination. Meantime, our communication agency will work to produce the communication campaign, so you will be also informed about it. And we try to arrange as soon as possible for the logistic aspect for the ones that will be interested to join in person our meeting in October. Before the meeting in October, you will receive some other introductory preparatory documents. We are interested to show you a short survey, but also another draft document, the open letter that you are interested to produce and share after the summer break, devoted and tailored to the European institutions. From my side, that's all. Thank you again. Have a safe fly. We keep in touch and hopefully also in October in the next meeting. Thank you all. Bye.
Bye-bye. See you next time. Bye.